It's a pleasure to come back and talk a little bit about the Cleveland Clinic and the Cola Institute and what we have been doing at the Oncology Service for about 13 years now. So I've been fortunate since I was hired here by Dr. Hillel Lewis about 13 years ago to start the Oncology Service as part of this excellent institution. I know, get enough media blitz about the Cleveland Clinic and many other things, but I want to show some key elements that are, I think, important. So we are, of course, non-profit, but we are profitable. And I think that's important. I think my personal view is that if we were not profitable, we'll be shut down tomorrow. So we've got to be profitable. But if in the process we can provide excellent service, and that's what we try to achieve. So there's a large number of employees. You can see with 3,200 physicians, 1,800 residents and fellows, from many places. I think the slide switched over. And just in oncology itself, I take now 2 fellows, one clinical and one observer, and sometimes we have research physicians. So we have, for the first time, we have a Clevelander who is a clinical fellow, and Dr. Zahrani, who is a visiting fellow from Saudi Arabia. And we have Dr. G from Shanghai, who is a research fellow, supported by Ratner Foundation. I'll come back to it. So, and next year, I can tell we are taking a fellow from Quebec and from South Africa for the first time, going to the African continent. So we're trying to serve all kinds of people. We have broad outreach, at least in oncology field. So coming back here, you can see we are one of the top 5 hospitals, so many patients, and that's fine. Coming back to the Cole, we're part of a bigger campus, and some of you have been there, or most of you will come tonight. We'll have an excellent reception in the lobby. Cola Institute is a freestanding building. We see thousands of patients per year. We have 55 ophthalmologists now. It's approximately 3 times the size since I started 13 years ago. So we're really growing fast. We have several optometrists, many scientists. We're number 1 in Ohio, and number 6 in the country. That's not a small achievement, being number 6 in the country. You think about big names, and you can see we are only approximately 15 years old as far as the building and the name goes. So to have such a rise, it can never happen before in the history. So it really is a remarkable achievement because of the support we get. We have many, many accomplished physicians, not just good surgeons or physicians, but thinkers, editors, people who write contribute to medical literature. We have so many of them. You can see there are many, many journals are represented. Dr. Trabulsi, Dr. Holyfield, Kaiser, Perry, Garcia, Dupes, Ellis, you can go on. And they all are academicians, okay? This is another layer. You can think when you come to somebody, they are educated, they understand the literature, they know, they write the literature. So it's a different quality of physicians, and I'm very, very privileged to be part of them. We're also doing excellent work within the field of uveal melanoma. Some of the patients, you may have contributed a blood sample or signed that we could work on the tumor sample, and some others just the clinical observations. So more importantly, you hear about tomorrow about the biomarkers. So just something like, PSA for prostate cancer or some other markers for breast cancer. Is there something in the blood that you can detect that goes along with your something happening in the liver or response to treatment for liver, even before you have a detectable disease in liver? So that's the future. Because if you're trying to treat patients without detectable metastasis, or you're trying to treat micrometastasis that you cannot see with any scan, then how do you know it's there? But we know because we have scientific data that it happens, but we have no detectable disease. Then how do you know you're getting rid of it? So you need some markers that you can say, well, it's a reflection of that tells us that we're getting rid of the microscopic disease. So we're working in that area, and you'll hear about it tomorrow. We're working on adjuvant therapy. Some of the data is published, and I'll show some slides related to that. And my own personal work related to prediction of vision loss after radiation therapy. So I told you about 85% of uveal melanoma patients are treated by radiation. But the side effect is loss of vision and can be predicted. But there are now mathematical tools. We have some online calculators we are trying to work on to figure out, say, what's the chance of going blind in that eye 5 years from now if you have radiation treatment. We have enough data from our own practice, and we're trying to make models of that. So before you have radiation, you say, well, I have 90% chance of going blind in that eye. Maybe I shouldn't have radiation. Or one can say that you have a high chance of not losing vision, then radiation becomes an excellent option for you. Or if you have a high chance of going blind from radiation, perhaps you should look for other therapies, and you'll hear about that after my talk. So these kind of tools that are not just telling you what's happening now, but are predicting the future, is of tremendous help to the physician and to the patient also in trying to choose or navigate through different options. So we have been working on that. And of course, the mission of education through fellowship, and I'm grateful for support by Ratner Endowment that supports the research fellowship for the next 2 years. So we have another person coming next year. So I'm grateful for that. Also based on all the patients that come through and what I've learned personally, put together into books. We have books on biopsies, books on radiation therapy, and uveal melanoma is not the only thing we treat. We treat lymphomas, retinal tumors, eyelid tumors, and other things. So these are some of the books that I put together. Big book on uveal tumors is outside my office. Many patients will go through it when they're waiting to see me. Some have even taken it home to read about the chapters on brachytherapy, etc. And I told them I will not do the operation till they bring the book back, okay? So most of them remember to bring it back. But they're asking for information, and I'm not saying this is the only information, but this is one good source of information. Now, of course, more importantly, last year, for the first time, we started a journal dedicated just to ocular oncology. So we are not behind retina. We are not behind some other journals. Now, nobody wants to hear about melanoma in the bigger field of, say, macular degeneration. So we started our own journal that's supported by Kargar Publications. So this has been out now for more than a year and is being adopted as the official journal of the International Society of Ocular Oncology. So we're going to have our own journal, which will be published 3-4 times a year. So that's coming out of Cleveland. I'm the editor of it. But in any case, this is another effort that we've done. So over the years, we have become very busy at Cleveland Clinic, at the Kola Institute, and we're going to have some expansion. And maybe we can talk more about that too. But we have a new building coming up, hopefully. This is the present building, and this is the new building right next to it, which will be where all the operations will move, and all the clinics will be left here, and all the surgeries will be done here, because we're running out of space in the main campus. We're in fact running out of space in Cleveland, so we moved to Abu Dhabi. You heard about Cleveland Clinic, Abu Dhabi? I think it's like 1 million square foot or something. Maybe, is that correct? I think people can park their camels inside the building. But they have real palm trees inside the building. Okay. And Eye Institute of Ophthalmology is a very integral part of this. And over the years, we are going to have kind of exchange programs and relationship with them. This is an independent entity, part of our bigger. They use the same structure, same computer software, same everything. So there's a lot more happening here, not just here, but nationally and, of course, internationally too. So I think, at least for us, it's an exciting time to be at the Kola Institute, because I think every day and every hour we try to the best we can. And I think this is a great motto for all of us. Thank you very much for coming here. And I have to say that it's a very different tone one has to take when you're talking to the patients, because normally we speak big things and trying to impress your peers or fellows and residents. And I'm not trying to impress you here. I'm just trying to be humble and trying to kind of feel some of your suffering in some ways that say maybe we should do better, or try to understand your perspective and not just be kind of saying, I'm better than someone else, or that kind of approach, So I think it's just a nice feeling just for us also to take part in this endeavor. And of course, grateful to Grant for taking this personal, let's say, putting all his energies behind this. And I want to make this meeting a positive one, okay? Something that's proactive, something that's, we are persistent in this, but definitely positive, because I'm sure in the next few years, we are going to have very exciting things coming our way. And you're going to hear about at least one of them in a few minutes. Thank you again.